A well-proportioned body is often considered an ideal of health and fitness. Despite good health and a reasonable level of fitness, some individuals may still have a body with disproportionate contours due to localized fat deposits. These areas of excess fatty tissue may be due to heredity rather than a lack of weight control or fitness. If you are bothered by excess fat deposits that do not respond to diet or exercise, liposuction may be right for you. In general, liposuction slims and reshapes specific areas of the body by removing pockets of excess fat to improve your body contours and ultimately enhancing your self-image. Liposuction, also known technically as lipoplasty, is a cosmetic procedure, one you elect to undergo to improve your personal appearance. Liposuction can remove excess fat from several regions of the body, including beneath the chin, called submental liposuction, the upper arm, the male breast, the female breast and underarm region, the upper and lower abdomen, the back and flanks, the waist and love handles, the hip, thigh, and buttock region, the legs including the knees, calves, and ankles. This program presents an overview of lipoplasty, commonly referred to as liposuction. It is not a substitute for a complete consultation with a plastic surgeon certified by the American Board of Plastic Surgery or the Royal College of Physicians and Surgeons of Canada. A consultation with a board-certified plastic surgeon, a member of the American Society of Plastic Surgeons, who may also be a member of the American Society for Aesthetic Plastic Surgery, is the first step to learn how liposuction can enhance your appearance and improve your self-image. In general, a consultation will include a discussion of your goals, an evaluation of your individual case, and the options available to you. Your surgeon will also discuss the course of treatment recommended for you, the likely outcomes of liposuction, and any potential risks associated with the procedure. Your plastic surgeon will answer any questions you may have about liposuction. During a consultation, you will be asked to share your expectations for your surgery and your personal health history. Full disclosure of your health history is important for your safety. You should inform your physician of any life-threatening illness or medical conditions in your family. You must also be candid about your current medications, vitamins, herbal supplements, alcohol, tobacco, and drug use. Liposuction is best performed on healthy adult men and women who are generally close to their ideal body weight. Good candidates for liposuction are individuals who practice good eating habits and exercise regularly. In addition, good candidates are individuals who do not have a life-threatening illness or medical conditions that can impair healing. A positive outlook with specific and realistic goals for improvement of your appearance is essential. In addition, good candidates have healthy skin that is firm and elastic and will conform well to new, slimmer contours following liposuction. If you smoke, you are at increased risk of poor healing, including the formation of irregular scars, and therefore, it is advisable to stop smoking for several weeks before and after surgery. Certain health conditions may preclude you as a candidate for liposuction or require special precautions. These conditions include cardiovascular disease, high blood pressure, or certain other circulatory disorders and diabetes. By making the decision to consult with a board-certified plastic surgeon and following physician recommendations, you are taking an important step in helping to ensure your safety. A board-certified plastic surgeon is a physician who is specifically trained in plastic surgery of the face and entire body. Prior to your procedure, you will be asked to sign informed consent documents. These documents assure that you fully understand the procedure you will undergo and its potential risks and complications. In addition, you must commit to precisely following all of the instructions you are given. Instructions include pre-surgical considerations such as testing and medications, day of surgery requirements, medications, and specific information related to the use of anesthesia. Prior to surgery, it is important to discuss all your questions and convey to your surgeon any concerns you may have regarding your surgery. Liposuction may be performed in an accredited office-based surgical facility an ambulatory surgical facility, or a hospital. Patients will be under local anesthesia, either with or without sedation, or general anesthesia. The decision for anesthesia will be based on the requirements of your specific procedure, any additional procedures that may be performed in the same surgical session, and considerations of patient and surgeon preference. Liposuction may be performed in conjunction with other surgical procedures. Commonly, these procedures include a neck lift, breast procedures, a tummy tuck, or body lift procedures. Multiple procedures can increase the length and complexity of surgery, and therefore can increase risk of complications. Discuss this thoroughly with your plastic surgeon. Liposuction is a surgical procedure that requires small incisions in or near the area where excess fat will be removed and new contours will be shaped. In general, a cannula is inserted into each incision to loosen excess fat and sculpt new contours. The fat is then removed from the body using a surgical vacuum or powered suction device. Liposuction may be performed with one or a combination of these techniques. The super wet technique, or alternatively a technique called tumescence, requires an infusion of saline solution with added adrenaline and possibly anesthetic prior to removal of excess fat. This allows the fat cells to swell and blood vessels to constrict, with the potential need for only a local anesthetic, less blood loss and bruising. Ultrasound-assisted liposuction, or UAL, includes the use of ultrasonic energy to liquefy excess fat prior to surgical suctioning. This may be done through a cannula that emits ultrasonic energy inserted in the treatment area prior to fat removal. Power-assisted liposuction uses a power-driven device to help break up fat deposits before suctioning, rather than your surgeon's physical power and thrust. Manual suction uses no power, but rather a syringe attached to the cannula to manually withdraw fat. Manual suction is more commonly used for smaller areas, such as the face, or to harvest fat for use in fat grafting. One or multiple areas of the body may be treated with liposuction in a single session. Large volume liposuction, which may require special precautions, including an overnight hospital stay, is defined as suctioning greater than 5 liters or 5,000 cc's of fat. Depending on the size of the cannula used, your incisions may or may not require stitches. You may have small, thin tubes placed in your incisions to drain any excess fluid that accumulates, or you may be placed in a compression garment or wrapped in elastic bandages to reduce swelling and to help your skin conform to your new contours. Before being released, you and an accompanying family member, friend, or caregiver will be given specific instructions and signs to watch for in the treated regions or in your overall health. Your plastic surgeon will advise you to begin light walking immediately after your procedure and to engage in light walking every 2 to 3 hours regularly in the first few days after liposuction. Other instructions may include drain care, wound care, and wearing compression garments around the clock in the first weeks following liposuction. Follow all instructions carefully. This is essential to the success of your outcome. You will also be instructed when to follow up with your plastic surgeon. Following liposuction, you may experience numbness, bruising, and soreness. In addition, your skin may feel unusually firm. These are all common conditions. Any discomfort you experience can be controlled with oral medications. Complications associated with liposuction include uneven contours, rippling or loose skin or nerve damage, irregular pigmentation, infection at the surgical site, fat clots, blood clots in the legs, blood pooling beneath the skin or hematoma, fluid loss or fluid accumulation called seroma, and infection or poor healing of the incision site. Puncture of internal organs is a very rare but possible occurrence. All surgery carries risks associated with anesthesia. Ultrasound-assisted liposuction carries the additional risk of thermal burn or heat injury. Depending on the extent of your liposuction, you can expect to be up and about within a few days following surgery. Initial healing of incisions may take 5 to 10 days at which time any sutures will be removed if necessary. Healing will continue for several weeks to months as swelling continues to resolve and your new contours take shape. Secondary procedures may be required if skin has not conformed to new contours or if rippling, dimpling, or uneven contours result. It is important to resume good eating habits and regular exercise after liposuction to maintain your weight and your new proportionate body image. Diligent sun protection is essential in the first year following liposuction to prevent pigment irregularities. Choosing to undergo liposuction or any plastic surgery procedure, whether cosmetic or reconstructive, is an important decision. So is selecting a plastic surgeon. Not all doctors who perform plastic surgery or who use the title of plastic surgeon are board certified in plastic surgery. In order to be certified by the American Board of Plastic Surgery, a physician must graduate from an accredited medical school and then complete a minimum of 5 years of surgical training, including an accredited plastic surgery residency program. The physician must pass a comprehensive written and oral exam in order to become a board-certified plastic surgeon. The American Society of Plastic Surgeons and the American Society for Aesthetic Plastic Surgery have prepared this educational program to supplement your personal consultation with a plastic surgeon who is certified by the American Board of Plastic Surgery or the Royal College of Physicians and Surgeons of Canada. Plastic surgeons with this certification have completed approved surgical training and rigorous examinations in plastic surgery, including both cosmetic and reconstructive procedures of the face and entire body.
My name is David Janssen, and I'm going to talk with you today about liposuction. Liposuction is probably one of the most poorly understood of the procedures that we do in plastic surgery because it's been covered on television so poorly and so archaically as to not represent what we do. Liposuction is an incredible tool that's been developed in France and is now used widely in the United States. When it was originally developed, liposuction was basically putting a patient under a general anesthetic, putting in a large bore tube, and removing fat. The fat removal was, quote, a blue jean operation, not a bikini operation, because the large tubes utilized left grooves and divots and unevenness of the skin that left patients with a very unacceptable cosmetic result after this procedure done, which was for cosmetic reasons. The difference in liposuction really has come in the last 10 or 15 years, even though most depictions on television are of old-style liposuction. The difference starts with pre-filling the fluid, pre-filling the area where you're going to do liposuction with what we call tumescent fluid. It's really intravenous fluid with a very dilute amount of local anesthetic and a medicine called epinephrine, which drives the blood out of the area. By putting that fluid into the area that's going to be liposuction and waiting 15 or 20 or even longer minutes prior to doing liposuction, you can do a liposuction procedure in many patients under purely the local anesthetic. We do this in our office for relatively smaller volumes, 4 pounds, 5 pounds worth of liposuction. Patients who need more may want to do it in an operating room, or if it's a very sensitive area like men's backs or women's backs, men's breast areas, sometimes doing it under an anesthetic works better just because of the local. But liposuction done under tumescent anesthesia is really painless and for the most part bloodless liposuction. The next great advance besides tumescence is the use of small cannulas. By using really small liposuctions, smaller than a pencil, smaller than a pen, the tubes used then don't cause rippling and grooving because you don't remove any large amount of fat with any one pass of the device. The device passes through the tissue, it passes around the nerve and around the blood vessel because it's small caliber, and the nerves and the blood vessels tend to be resistant and don't get ripped. There's much less bleeding, much less bruising, and much less rippling and flawing of the skin afterwards. So it becomes a bikini operation instead of just a blue jean operation. It's not just large volume removal, but large volume finely removed. Very rarely seen on television. Normally it's a very aggressive type of procedure you've seen on television, and it is simply not what we tend to do. The other advent besides small cannulas for liposuction is the use of the power-assisted device. The power-assisted device is a handpiece that we put the liposuction cannula on. It vibrates back and forth only about 3 millimeters, a very short distance, but 1,000 times a minute. And as it goes back and forth with small cannulas and passing the device, much more like playing a violin than assaulting somebody with a stick, this device now allows us with power to get volume off with very precise strokes and passage, so it's much more like playing a violin and getting a much more even reduction of tissue thanks to preoperative marking and great experience doing liposuction. The last device I'm going to talk about to only say we have it, we use it, and we are board certified plastic surgeons who use this device, is the internal laser. The internal laser is great for heating the tissues below the level of the skin and getting the skin to contract a very little bit. In general, it doesn't work. It works very well for very thin skin, like in the submental area under the neck, the inner arm, and the upper inner thigh. But the vast majority of patients who have laser liposuction done on their stomachs or inner or outer thighs really don't need it. And so although we have it available and it is more expensive to do it, and we do the procedure, laser assist for liposuction is best used for very selected patients and is not an answer for all cases. We now know in plastic surgery it's the operator more than the device that gets the best result in liposuction.